Approximately 1,000 years ago, a pathogen, which occurred in cattle populations, reached a point of evolutionary divergence. This pathogen, called the rinderpest virus, had spread from one species to another, most likely due to the close proximity in which the two animals had begun to live. The species that had become susceptible to this pathogen was the human, and the disease itself would eventually come to be called the measles. The measles, or as it is also known, rubeola, is a disease caused by a paramyxovirus, which attacks the human respiratory system. Measles is spread via droplet infection. This refers to an infection through contact with bodily fluid, generally mucus or saliva from the infected patient's nose or mouth. This type of infection can also arise via direct contact with bodily fluid, which is likely to occur in close quarters. While the human body is capable of fighting off the disease, in many cases the infection can prove to be fatal. Signs and symptoms indicating a measles infection include a fever that lasts for several days, and most notably the distinctive red skin rash which develops and spreads quickly over the whole body and can cause painful itching. While measles is perhaps best known for the accompanying rash, additional complications that may arise due to the infection include diarrhea, fever-related pain such as head and body aches, pneumonia, conjunctivitis or pink eye, which can eventually give way to corneal ulceration and scarring, and encephalitis, a swelling of the brain. In the 1950s, Dr. Maurice Hilleman developed vaccines for several of the most prevalent and dangerous viruses in the world. Among them was the measles vaccine. As a result of his work, measles is well controlled in developed nations, particularly in the Western world. The development of a vaccine for the virus has led to a large reduction in the total number of cases worldwide since it was introduced, and the later introduction of the combined vaccine injection known as MMR for measles, mumps, and rubella nearly did away with those viruses entirely in all nations where they were readily available. In the United States and the United Kingdom, the rate of infection has fallen precipitously since the introduction of the vaccination, with a further and more conclusive decline occurring in 1988 when the MMR vaccination was introduced. As of now, treatment for those who are infected generally involves the easing of symptoms through pain relievers and a focus on avoiding or mitigating complications which may arise from the infection. In the last 150 years, the estimated death toll as a result of measles is approximately 200 million worldwide. But despite the virus having very little presence in modernized nations, even at low levels it is still endemic and has not been totally wiped out. The measles vaccine and the subsequent MMR vaccine are estimated to have saved 1 million lives every year. In underdeveloped nations, there are still occasional epidemics, particularly in Africa and East Asia, and steps must continue to be taken in order to provide full vaccination to the entire world. In a recent turn of events, there have been notable cases of measles in the US and UK, which have occurred in the wake of a study which claimed to prove a causal link between the MMR vaccine and the onset of autism in children. The report, which was published in the well-regarded British medical journal The Lancet, claimed that children developed autism spectrum disorders almost immediately after receiving the MMR vaccine.
This 1998 study, published in such a prestigious journal, has been used for more than a decade in the highly charged debate over what causes autism.
The man responsible for the report was Dr. Andrew Wakefield. In response to this widely publicized finding, many parents began to refuse to let their children receive the MMR vaccine. As a result, new cases of measles began to occur around the British Isles. This report has since been discredited for numerous ethics and practices violations, including payments made to Dr. Wakefield by lawyers who were attempting to bring suit against vaccine producers. Dr. Wakefield has since been barred from practicing medicine. However, the controversy that he created has yet to fully abate. Long-held suspicion of the vaccine process among those who do not fully understand it has led to a resurgence in viruses like the measles that had been well contained for years.
I invite anyone to examine the contents of these proceedings and come to their own conclusions.
Hundreds of children in the United Kingdom and Ireland were hospitalized. 4 children were killed by measles virus, a virus that could have been safely and easily prevented by vaccinations.